there. I'm Chad Summers. I was diagnosed with melanoma in both lungs back in March 2010. And I had no primary cause. I didn't see, any mole that was the cause of it. They also found an aneurysm in my ascending aorta. Found both of those at the same time. It's like double whammy. So, and then I was treated with dicarbazine, the Altu, epimumumab, and now I'm on the PD-1, the Keytruda. And I've had no side effects whatsoever with it. Just amazing. No, I've had great shrinkage on it. I'm only have a little bit of a tumor left. It's probably millimeters. I've got through surgery. You name it. Yeah, it's been almost 5 years. So I like to first thank Jesus. And I thank Dr. Cowan for everything. I guess that's 5 minutes.
You want to talk about
any other questions? I don't know what else to say.
Yeah, so you want to talk about, so you've had a lot of different treatments. You've been through interleukin-2.
The L2.
Do you want to talk about that experience a little bit?
That's a horrible experience. You'll be in the hospital for 2 weeks, and then you'll bleed through your capillaries, and you'll swell at the end of a week. And then, it's awful. And then they give you, what are the type of drugs to get the fluid out of your body?
Diuretics.
Oh yeah, it's awful. And your mouth is just dry. It's awful.
Okay. And how's your experience with the newer drugs?
Oh, the newer drugs are so much more advanced, less side effects, and better results. I've had just a little bit left of cancer now.
Okay. Mr. Lindstrom, do you want to tell your story? You have quite a bit of different story. So.
Yes, just kind of a little background. Back in 2002, I was diagnosed with multiple myeloma. I guess more accurately, maybe just light chain disease, and had a stem cell transplant in 2002, and chemotherapy, of course, went along with that, and just kind of as a reference to the advance to my melanoma situation, in 2011, had a place on my face, started out just fairly small, but got a little bigger, got to the point where I would nick it when I was shaving, so it was getting irritated, and finally I just went in and said, get this thing off my face, and they called me a week later and said it's melanoma, and I didn't really no history of that kind of thing in the family. Of course, I was growing up out in the sun all the time, and I don't know, I guess that could have played a part in it. But after that, they had to do another surgery, and then they found cancer in a lymph node, so they went in and they did another surgery to take out lymph nodes, and then a few months later they found it in more lymph nodes, so they had to go back another time. So I wound up with 3 or 4 surgeries on my face, and at that point they decided to do some radiation. So I went and I had radiation done on the side of my face and down in my neck. And then that was, I guess, the early part of 2012. And then on my birthday, in September 10th of 2012, I had an appointment with Dr. Cowie. I went in and he got to tell me that it had spread throughout my body. And so that wasn't a very good birthday present, Dr. Cowie. But so at that point, Dr. Cowie decided to go with the Yervoy, the ipilimumab-dabadu, however you say it. But we started on that in October. Treatment went through December. My job is I do sports television. We're in the fall, so this was in September through December. During that time, I do college football, so I'm traveling every weekend, doing a football game, and then coming back. And I was able to do my job all throughout the fall. Never had to take time off. I think my worst side effect on the Yervoy was probably the itching, I think. But I didn't have a whole lot of side effects otherwise. And so the treatment ended in December, and first PET scan was, I think, in January after that, and it showed a significant decrease in all the tumors. And I think by May, had another PET scan in March, I think, and then maybe May, there was nothing. And so far, nothing else since then. It's been so obviously the difference, going back to what I said at first about the other cancer, the immunotherapy is such a great difference between the chemotherapy. I mean, it's just night and day, and I think you mentioned that you hadn't had a lot of side effects either. But being able to not have all those really horrible, terrible side effects that go along with chemotherapy was truly nice, and especially since it allowed me, being self-employed, I was able to continue to work that whole time. So there it didn't become a burden financially so much because I was able to continue what I was doing. And just a side note, I guess, that I would like to say is obviously I put a whole lot of faith in Dr. Cowie and Baylor, and I trust what they do. I also think your attitude, your perspective, and for me, faith plays a large part in it. My perspective is we're all individuals, we're all different, and I know for me, my wife is very detailed, very, very detailed, Stephanie. Me, on the other hand, I like to look at it from the big picture. So I didn't really want to know the survival rates of whatever. I kind of have a more blinder view of, okay, I have a problem, so now what are we going to do to fix it, and let's get on with it. And that's just kind of the way I am. I mean, I have kids and a beautiful wife and things that I want to do and get done, and help me to get to that point and move on with my life. And I was very thankful that Dr. Cowie had a plan for that and a drug for that. And obviously faith, a lot of prayer went into my treatment and my experience through that, and I believe wholeheartedly in that. And so I think the combination of all those things really made a difference for me.
Well, I really appreciate you guys coming and telling your story. And there's a lot of stories in this room. I know a lot of them. And, I really wanted you guys to come in because I think your stories bring hope. And, this is a cancer where we need hope. And, I think that you've both had drugs that have, been sort of new and cutting edge. And, I think it really, we wouldn't have these drugs without, the trials that were done to study them. And so I really thank you guys for coming and sharing your story. And I think we're running short on time, so we're going to move right into the question and answer panel. So thank you guys again for coming up.